mobility before stability, when you think about the concepts and motor control. And one of the things that really want to stress is improving your mobility in certain areas, primarily the thoracic spine, the anterior hip, and the upper cervical spine will greatly enhance your balance and fall prevention exercises. So I'm going to go through a thoracic extension exercise that you can do with a towel as well as in a standard chair. So have your patients take a towel, wrap it around their mid-thoracic spine, like so, put it up where they're comfortable. And what you want to do from this position is you're going to pull forward, take a deep breath in, expand those lungs. As you know, the rib cage attaches to the transverse processes of the thoracic spine, and then exhale. You may even get a couple of little cavitations in through there. Breathe in, exhale. So you've got a lot of patients that have thoracic mobility that has started to go where? Started to go this way. As the thoracic spine goes that way, the pants start to go this way, right? The hips get tight, the butt goes out, you have that hip strategy gait, or you got that ankle strategy gait, right? So either way, you want to make sure that improving the thoracic spine mobility with a towel between the shoulder blades, extending for 10 repetitions, would be a good thing to do before you do your balance exercises. Using a chair, now this chair has a little bit of flexibility going back, not the typical chair, but you'll get the point. You put the chair like so. You can put a little bit of a roll towel behind the back, which will give you a little bit of lordotic position, because if you want to put your thoracic spine into extension, put that lumbar spine in a little bit of lordosis from there, and then tighten the abdominals. Keep the abdominals tight, extend backwards. Come forward. Now, hands can go across the chest. If the patient has difficulty putting their hands back there, put their hands across their chest. Grab onto a towel here. So just imagine that I have a lumbar roll back there and I can't get my hands back there for various reasons. I'm going to use this to extend back. Make sure you breathe in and then exhale on the way back, or exhale on exertion. It's very important to breathe in and fill up that lung capacity, and as you extend backwards, you're going to greatly improve the ability to go back into extension. A couple of ways to get extension. Now, since I'm in the seated position here, we'll go to rotation. Okay? So rotation of the thoracic spine, clasp your hands, breathe in, blow out. Breathe in, blow out. Rotation is a forgotten plane in therapy. A lot of patients have problems with sagittal plane movements. Getting up out of a chair, sagittal. Walking, sagittal. Stair climbing, sagittal. What happens? If you don't work the transverse plane, you're not going to improve the mobility in the sagittal plane. So if somebody has sagittal plane impairments, work them in transverse plane, you'll see a huge change in their ability to perform whatever sagittal plane impairment they have. So, again, clasp, rotate. Clasp, rotate. 10 repetitions, just stay with something simple like that, 3 sets of 10. Try out those thoracic mobility exercises before your standard balance program, you'll see the difference.